Hello and welcome to our 5 on 5. We're joined here today by Amy Coven with the Oregon Health Insurance Marketplace. Amy, thank you for joining us.
Thank you for having me.
Now, we have some looming deadlines when it comes to healthcare. First and foremost, can you tell us about open enrollment?
Yeah, open enrollment is the main time when folks here in Oregon want to sign up for health coverage. It's November 1st till January 15th, and it's really available for anyone who doesn't have coverage through a job, through Medicare or Oregon Health Plan, something like that.
So who is open enrollment for? I know you mentioned a few there. What kind of coverage is available through this marketplace?
Yeah, the marketplace is really going to give you a slew of options from really big health insurance companies that you're probably familiar with. Some include, for example, Moda, Pacific Source, Providence, Regents, Kaiser Permanente, just to name a few. And so there's a lot of options available. The marketplace is really great for, like I said, people who don't have coverage available through a job or a public program like the Oregon Health Plan or Medicare. And it's really phenomenal for folks who are self-employed, work for small businesses, or maybe work part-times or gigs, and so don't have coverage through a job.
Yeah, absolutely. Now, you mentioned open enrollment going into January. Are there any other deadlines that people should be aware of?
Yeah, the first deadline is actually coming up tomorrow. You have to enroll by December 15th in order for your coverage to start on January 1st. But the big deadline is January 15th. And if you enroll by January 15th, your coverage will start on February 1st.
Okay, great things to know. Fantastic to keep in mind. Now, open enrollment happens every year. Is there anything that's different or special about it this year?
Yeah, so last year, financial assistance was expanded. So more people were eligible for financial help than ever before. This year, financial help actually expanded even more. So people who previously were found ineligible for financial help because of coverage available to them through a spouse or a partner or a parent's job may now qualify for financial help if that coverage is considered unaffordable. So we are encouraging everyone to apply, even if you haven't been found eligible for that financial help in the past. It's important to try again.
All right, fantastic information. Thank you, Amy. We'll be right back after this break. Hello and welcome back to our 5 on 5. We're joined by Amy Coven. Now, a big concern for a lot of people when it comes to insurance is, of course, cost. Is healthcare expensive, and is there any financial aid available?
Well, I think we all know that healthcare can be expensive. That's where health insurance comes in to really protect your pocketbook and make sure that you have that coverage when life happens. I think we've learned over the last couple of years that things can get thrown at us and we might not expect it. So health coverage is really important. It's a little bit different than other lines of insurance because you don't have to wait until you're sick to actually use it. A lot of benefits are included even before you meet your deductible to try and help keep you healthy. For example, there's a whole group of preventative benefits that are available on all plans sold through the marketplace, and all of those are free of charge as long as you're visiting an in-network doctor.
So we talked about the what, the why, the who, so let's get to the how. How do people get started doing this, and is there any help if enrollment is confusing?
So a couple of things I want to mention. The first is that folks should not be, worried about the cost initially. We encourage everyone to stop at our website, OregonHealthcare.gov. And the main reason is you can check and see if you're eligible for financial assistance. Financial assistance is only available if you go through the marketplace, and there is help on both your monthly premiums and your out-of-pocket costs. And if you go to our website, we have a really easy to use tool where you can preview the plans that are available, how much in financial help you might be able to get, and also compare your plan options. Now, we understand health coverage can be very confusing and overwhelming, and especially with so many different plan options to choose from, it can be a little daunting. So we do work with experts around the state who can provide free one-on-one assistance with both the application process and choosing a plan and getting enrolled. So again, come to our website, OregonHealthcare.gov, and you can find an expert that can help you right where you live.
All right. Well, once again, a wealth of information, also important. Thank you so much again for joining us, Amy.
Thank you.
We'll be right back.